Welcome to The Secret Life of Teeth, a series designed to help you unlearn everything you thought you knew about caring for your teeth. I'm here with my favorite dentist, Sanduta, and we're going to take on your questions about caring for your teeth. Today, Anna, I have a very important question for you. And first, let me welcome you. Thank you for joining me.
Thank you for inviting me. I'm very happy to be with you again.
Yeah.
Thank you.
And you know, Anna, I have so many questions when it comes to this area of how we care for our teeth. And I love your way that you dive into it and connect it with our health of our whole body because our teeth are part of our body. So here's today's question from one of our listeners, and it's about when we begin to get decay in our teeth, or an inflammation or a cavity, what can be done aside from having a drilling and filling of a cavity? Is there something I can do? Um, and even more importantly, does gemmotherapy play a role or could it in the healing of my teeth?
Yes, there is a very good question, Lauren. And maybe we can talk a whole day on this topic.
Sure.
But let's begin from some point. A feeling or a dental treatment don't initiate the regeneration of the dental tissues. A feeling is building up the architecture of the crown, rebuilding the architecture of the crown of
Okay.
the tooth, but um, don't heal the cavity.
Right.
So in parallel, I have to carefully look what determined my cavity.
Okay.
And a second good question could be, how can I help my body initiate the healing process?
Yes.
And here we can walk two ways. One way could be our inner work that nobody can do for us. Yes, you can keep my hand, you can walk beside me, but you can't do my work.
Exactly.
And this inner work is how can I shift my perception to a point where to see all things, all events, all situations on a whole mode.
Mm-hmm.
I cannot say all decays have to be treated both dental procedures and alternatives. There are at least, let's say, two situations. Then I would go on alternatives for the first step.
Okay.
And this is superficial demineralization or a superficial cavity only in my enamel, and maybe a medium cavity in the dentin, but that cavity is totally enveloped or comprised
Mhm.
by the enamel.
Okay.
So then I would try to figure out what what from my mind determined this situation and what could be the alternatives. And for example, I would need your help this because I am realizing now that I know the names for gemos in Latin.
Oh, no
I
problem.
got
Bring it on.
um, I usually don't treat a teeth. I usually treat the whole body. But let's say I don't have now some associated pathologies. Let's say my ways of elimination are opened. Let's say my nervous system, autonomic nervous system is harmonized. I have to carefully look only in the pulp. How can I induce there the regeneration?
Mhm.
And I would need some to stimulate the odontoblasts to secrete new dentin.
Okay.
And for children, I would suggest Abies alba,
Okay, so this is silver fir.
silver fir, Betula verrucosa,
So silver birch buds.
exactly, and Rosa canina
Exactly. Dog rose. So silver birch buds, dog rose, and silver fir would be the combination for children.
for children, yes. For young adults and adults, here regularly we have associated pathologies,
Mhm.
but let's say we can use Betula pubescens,
So common birch,
common birch, um, Sequoia gigantea,
giant redwood,
Pinus montana,
mountain pine,
Rubus fructicosa,
blackberry.
blackberry, yes, and Rosa canina too.
Sure. Anna, can I back you up just a moment? Because you're using a term that you're familiar with and I'm familiar with, but our listeners might not be. And you're using this term associated pathologies. And I take that to mean that I have some emotional, mental
and
issues
physical and physical
or
issues too.
physical ailments that are unhealed in my body that would, so they may be going on at the same time as my dental
Mm-hmm.
issue. So we need to, when you're saying that, we need to be looking at the whole picture. And that's a whole nother program, and people can learn about that in the classes you're offering. But right now, you're saying, let's put that aside and let's just talk about the tooth. What can be done?
I calmed down. I've calmed down my nervous system. I've temperated somehow my other problems.
Yes,
Let's focus now how I create new dentin, new dental structures.
right. Okay, okay. And then this list of gemmos, Anna, that's 5 extracts for an adult. Could we rotate some of them, or are you picturing using all 5 at the same time?
I don't use. I gave only the 5 categories,
Yes.
but I
Yeah.
would choose them attentively.
Yes.
Let's say with the common birch, Betula pubescens, every time I love this tree.
Yeah.
I deeply love it, and I would associate it with all the time I use this with other um,
Yeah.
inductors for dentin,
Exactly.
even if it's a pine or sequoia or
Hmm.
blackberry.
Hmm.
But all the time, my guideline is the common birch.
Exactly. Okay. Okay. Perfect. That's, I think that's good information for our listeners. And in my approach, I would have them rotating, doing common birch with 1 or 2 for a month and then changing that up a little bit.
Yes, because I want to explain this too. In the first time, I have a pre-dentin. It's not too mineralized dentin. So the process would last 6 months, 1 year.
Mhm.
In the cases where I've told you this would be my first step, inner work and gemos, I rotate the gemos, and after 6 months, 8 months, 1 year, I carry out another X-ray and and do another assessment
Okay, perfect.
to see how my way of treating this is working or not.
Exactly. Okay.
If it isn't working, my advice is to go for a filling,
Okay. Perfect.
but don't stop gemos. And what I've noticed in the last 2 years and in the last year, and because of the COVID, many people in Romania are using vitamin D, but I saw on the teeth association with the gemos, they work nicely for this process of mineralization of dentin, new dentin. So not with big doses. I'm not a fan of big doses, even for vitamin D. But with low doses, I would also associate vitamin D with gemos when I want to initiate new dentin.
Okay. Okay. So you would recommend that as well, but lower doses.
Lower doses, even if I am in summer or autumn,
Yeah.
because we don't stay as long as the sun to synthesize our vitamin D.
Okay. Okay.
So if I want to work on my teeth, I would this association.
Okay. Okay. And then what I
But
hear very clearly, if after 9 months or a year it's evaluated and the progress hasn't been made, then the tooth needs to be filled.
don't need, if all is good,
If
I have
everything,
new then yes, yes,
yes.
yes.
Okay, so if
If
everything's good, we don't need to fill the tooth. However, if it's not and there's no change, then your recommendation would be go ahead and fill the tooth.
yes, and the recommendation I would do, even if I don't have symptoms, I would do with a new X-ray,
Okay,
because I cannot see with my eyes inside a bulb.
yes. Okay,
And this is the point where I have the old X-ray and the new X-ray,
hmm,
and I make the comparison.
okay, okay, perfect. Anna,
But I would love to hear your opinion when we are talking about new new formation of dentin.
Anna,
If you
those,
have, if yes.
yeah, I mean the Gemmos that you suggest for our children, silver birch buds, um, um, silver fir, and dog rose, exactly what I would suggest as well. And then with the adults, common birch is always the main extract in there. I'm with you on that. Um, and I tend to go with something like mountain pine very often.
Mhm,
I've never used blackberry, but it makes perfect sense because we use it for other mineralization issues. So,
mhm.
um, obviously, giant redwood makes sense. And dog rose would come to me particularly in those folks that are a little frail, whether they're frail emotionally or they're frail, um, well, their emotional immunity or their physical immunity, which we know goes hand in hand, that would be where I would call that extract out.
Mhm.
Yeah, good.
Thank you so much. I love your visions.
Yeah, well, they're very similar. Okay, Anna, anything else on this topic you'd like to share with our listeners?
No, I've covered all. Yes.
Okay, perfect. Great. And I look forward to our next episode already.